Ophthalmia Neonatorum. Definition is defined as any conjunctivitis with discharge from the eyes during the first 28 days of life. Its etiology may be gonococcal or non-gonococcal, Chlamydia trachomatis being the most important cause in the later group.
Ophthalmia neonatorum is the most common eye disease of newborn. It is a type of conjunctivitis which occur in infants younger than 4 weeks of age. With these words, I am Dr. Manish and I welcome you all to another interesting clinical video on Ophthalmia neonatorum. So let's start. Four-day-old male baby weighing 2.8 kilos presented with complaint of discharge from eyes since morning. Full term appropriate for gestational age baby delivered at home. 28-year-old mother didn't take antenatal care. On examination, purulent discharge is coming from right eye, resulting in a sticky eye. Both upper and lower eyelids are swollen. Purulent discharge is also coming from left eye. If you observe carefully, you will note congested bulbar conjunctiva. Marked bruising and somewhat suffusion of the face is present as a result of face presentation. This type of face is considered the equivalent of caput, with the face as the presenting part. Based on presenting complaint and examination findings, a diagnosis of Ophthalmia neonatorum is made. Now let's have a look at causes of Ophthalmia neonatorum. It is caused by silver nitrate eye drops, Neisseria gonorrhoeae, Chlamydia trachomatis, Staphylococcus aureus, and Pseudomonas aeruginosa. The next step in evaluating these babies is establishing etiological diagnosis for definitive management. Whenever you examine a newborn with ophthalmia, the first question to come in mind should be, when did conjunctivitis appear? The cutoff time frame is 48 hours. If the answer is less than 48 hours, think of silver nitrate eye drops as the possible cause, which is instilled as part of topical ophthalmic prophylaxis at birth. But in our baby, it was not instilled. Our baby developed conjunctivitis on day 4 of life. Any conjunctivitis appearing after 48 hours should be evaluated for a possible infectious cause by sending gram and Giemsa stain, and based on findings of staining, appropriate cultures should be sent. The result of gram stain in our baby showed intracellular gram-negative diplococci, so a diagnosis of gonococcal ophthalmia is made and appropriate culture sent. Finally, coming to treatment, which consists of giving injection ceftriaxone in a dose of 50 mg per kg for one dose, not to exceed 125 mg. The eye should be irrigated with saline every 10 to 30 minutes, gradually increasing to 2-hour intervals until purulent discharge has cleared. Treatment should be extended if sepsis or other extraocular sites are involved. Then do post in the comment section below. Thank you.
Application in medicine. Ophthalmia neonatorum can be presented by the parents' avoidance of risk sexual behavior that could lead to sexually transmitted infections. 2. Routine screening for chlamydia and gonococcal infections in antenatal clinics followed by appropriate treatment. And 3. Dysfunction of the infant conjunctiva at birth.
Hi, I'm Dr. David Hill, and today we're going to be talking about what causes pink eye in babies. Now, pink eye is a very descriptive term. The eyes are pink, right? But I want to know what's making them pink. The first thing I'm looking for is discharge from the eyes. That an eye is pink simply suggests there's some sort of irritation or inflammation. But discharge is interesting to me. What's coming out of that eye? What's on the eyelashes, the eyelids? Now, in the first 2 to 3 weeks of life, it's very common to see blocked tear ducts. The tear ducts are tiny little tubes that help carry the tears from the inside of the eyelids down into the nose so they can drain. Otherwise, we'd have tears rolling down our faces all the time. Those ducts are so tiny when babies are born that they're often not open at all. When you have a blocked tear duct, you usually get some kind of mucousy or watery discharge, frequently from just one eye or the other. The best thing to do for that is a little bit of massage and a little bit of a warm washcloth. You can use the washcloth to get the goop off the eyes and also for the massage if you want to. Now, if the stuff that's coming out turns purulent, that's a word for full of pus and nasty and gross, then we're worried that perhaps there's been an infection there as well. That we're going to want to treat with some sort of antibiotic ointment or, in some cases, drops. In the first 3 weeks of life, if a baby has an eye infection, we have to worry about chlamydia and gonorrhea. Now, all babies who are born in hospitals are treated at birth for chlamydia and gonorrhea. You may think, I don't have chlamydia, I don't have gonorrhea, certainly my baby's not going to get it. The problem is many, many women who have chlamydia and gonorrhea don't know that they have chlamydia and gonorrhea. Many people assume they don't, but they actually do. So the only way to know for sure is to test. Now, the eye drops that we use, or the eye ointment, fixes gonorrhea, which can be a vision-threatening infection if it's not caught and treated in time, but it's not that good at catching chlamydia. So what we'll do is a little culture or some other test to look for chlamydia, and if that's present, we have to give an oral antibiotic given by mouth instead of an antibiotic that you just drop in the eye. After 3 weeks of age, we're not so concerned anymore about chlamydia and gonorrhea infections of the eye. We're back to the usual things: viruses, bacteria, and also occasionally a corneal abrasion. So how do you know the difference between a viral infection and a bacterial infection? Really, it's kind of hard to tell. Usually at the time, we treat all these eye infections as
Pros and cons. The risk of gonococcal and chlamydial ophthalmia in infants born to infect mothers may be up 30% and 50%, respectively. Gonococcal ophthalmia, if untreated, may progress rapidly to corneal ulceration, perforation, and eventually blindness. Chlamydial ophthalmia is generally milder.
Hi, I'm Dr. David Hill, and today we're going to talk about infant eye infection symptoms. So, eye infection symptoms are usually pretty obvious in an infant. The eyes may turn red, there may be pus coming from one or both eyes, there may even be some swelling of the lids. Now, these infections can be very serious, and we need to talk about different age groups. In infants who are 3 weeks old or younger, these are newborns, there's a very high risk of having an acquired infection of the eye from the birth canal that could be chlamydia or gonorrhea. Gonorrhea is a very, very serious infection and can cause blindness. Chlamydia does not respond to topical antibiotics, that is, drops or ointment that you would put right in the eye. You need to treat it with oral antibiotics, something the baby would take by mouth. So if you think that your newborn might have an eye infection, you want to make sure that the doctor does a culture to look for chlamydia and also treats with an antibiotic that would cover gonorrhea. Fortunately, the antibiotics you put in the eye do that. Now, a lot of infants in this age group will also just have a blocked tear duct. That does not require antibiotic therapy, just needs a little bit of massage. Usually the difference is that there's no redness of the eye, and what's coming out is more mucousy or watery instead of yellow and thick and nasty and what we call purulent, which is just looks like it's an infection. Now, for older infants who have eye drainage, we're still probably going to want to treat with an antibiotic, but it's not so important that we rule out diseases like chlamydia chlamydia or gonorrhea. Those infections are usually with more common bacteria like Moraxella pneumococcus or Haemophilus influenza. Most importantly, if you're worried about your infant's eyes, if you see redness, if you see pus drainage, and absolutely if you see any swelling of the lids, do bring that infant to a medical provider to get a look-see and see what needs to be done. Talking about symptoms of eye infection in your infant, I'm Dr. David Hill.
Issue applied in Ecuador. The incidence of Ophthalmia Neonatorum was 23.2 per 100 live births. An incidence of gonococcal and chlamydia ophthalmia were 3.6 and 8.1 per 100 live births, respectively. Of 181 cases of neonatal conjunctivitis, 31% were caused by Chlamydia trachomatis, 12% by Neisseria gonorrhea, and 3% by both.
Hello, this is Dr. Carlo Oger, emergency physician and founder of edxitvideo.com. This video is about Ophthalmia Neonatorum. If your child's been diagnosed with Ophthalmia Neonatorum and is having fever, lethargy, that means it's difficult to wake up, or poor feeding. If your child appears ill to you in any way, he appears fuzzy, irritable, or in pain. If your child's symptoms persist or fail to improve despite the treatment, you should come back to the emergency department. Ophthalmia neonatorum is an inflammation of the conjunctiva, the covering of the eye, during the first month of life. It may be caused by a bacterial infection and may require additional testing like gram stains or cultures for diagnosis. The symptoms of Ophthalmia neonatorum include pink eye, redness, drainage, and lid swelling. You may also notice matting or sticking of your infant's eyelids in the morning. Treatment. The treatment of Ophthalmia neonatorum includes warm compress such as warm wet washcloth, daily saline eye irrigation, and oral or intramuscular antibiotics. Medications are generally used for 7 to 14 days. Occasionally, a second course of antibiotics is needed. Follow-up is very important.
Conclusion. The baby's eyes are red. The eyelids and the white of the eye are swollen, and there is watering or a discharge. Usually both eyes are affected, but one may be worse than the other. One of the dangers of gonorrheal infection is that it may affect the cornea also. Early diagnosis is important, and for this reason, the optometrist is advised to refer cases immediately to the on-call ophthalmologist. Thanks for watching my video.